extra minutes.
What does many bullets, for example, 11 bullets into a child's body do? What's the impact of that?
It rips them apart. This is a horrible situation where the damage done is extensive.
And that's what happened to the children of your community?
Unfortunately, yes.
Pediatricians dropped what they were doing in the middle of a busy day.
Local paediatrician Dr Greg Dworkin will never forget December 14th last year.
Also, because it's such a small town, we knew people at the school. We knew people who had kids at the school. We had people in my own office who had people at the school.
At the district hospital, he and his colleagues frantically prepared for an influx of tiny patients, but none arrived. They had all died. When something like that happens in your community, do you feel sick to the core? Do you feel outraged? What's the visceral reaction?
Well, the first visceral reaction, I think, for everybody is shock. And frankly, that takes a long time to wear off. And only now, some of us are actually coming out of that fog and are starting to take a look and say, okay, this is what happened. And yes, there's anger, and yes, there's frustration, and also resolve, and a very, very strong sense of how can we look at the future and make sure that this doesn't happen again.
Now, local doctors want research to prove once and for all the facts related to gun deaths in America. What form would the research take? What do we need to know to be able to forward this debate then?
Well, for one thing, we would like to have a national gun registry of, not of people who own guns, but of people who are injured by guns, so that there's an injury registry. As has been done with many other illnesses, when you have the data as to who is injured, how and why, by whom, in what circumstance, then you can begin to analyze and get a sense of where the issues and where the problems are.
What the real truth of the gun is.
Research is number one. And the second tenet that we all came around to agreeing to, and this was not difficult, is support for mental health, making sure that people have both the funds and the access. And we want the workers, the mental health workers who work with patients, to be properly protected so that they could find the right balance between confidentiality and safety.
You don't ever want to see another Sandy Hook situation ever again. To be able to achieve that, surely the situation, the data, you would hope, would show that there's no need for everyone to have a gun.
We will go where the data takes us.
That's a diplomatic answer. That's a political answer.
But it's the only answer. In other words, you really have to have a fact-based, evidence-based approach to this. And if the data really say that, then I think that we and the public will follow. But you need the data.
Well, if the data came up and said guns are perfectly safe in all hands,
with the Second Amendment, that would be an argument to leave things be. I don't think that that's what it will show, but data's data. You know, if you're serious about doing the research and following where the data goes, then you're serious about doing research and following where the data goes. It's not that we have an agenda and we want to produce the data to agree with us, just the opposite.
Well, it'd be shocking to learn that this is as safe as it gets.
It would be shocking to learn, and I would expect that the data would lead us elsewhere, but we'll see.